The purpose of this video is to educate you on recognizing and responding to an opiate overdose. Opiate substances are frequently in our homes. They are medications such as morphine, fentanyl, oxycodone, hydrocodone. They're known by many brand names, and they're prescribed to us after painful procedures, surgeries, after traumatic events such as a broken bone, and they're also prescribed for cancer pain or for other painful conditions. Substances such as heroin and opium are also in this same class of medications. All of these substances lead to an overdose in the same fashion. It's very important to understand the risks as well as to be educated about what an overdose looks like so that you can be prepared should you ever witness one. There are certain signs and symptoms that you would look for that would indicate that's possibly what you are seeing. The way I choose to think about it and want you to think about it is, first of all, that people cannot talk to you and cannot move when they're experiencing an opiate overdose. They are totally non-responsive. The most important symptom that really is indicative of an opiate overdose are pinpoint pupils, very small pupils. When you open someone's eyes, when you open your own eyes, you'll notice the pupils go from big to small. In the setting of an opiate overdose, the pupils are very, very small, a very small black dot in the center of the eye. And this does not change. So if you pull someone's eyes open, you do not see that change. You just see a small, almost fleck of pepper in the center of their eye. That is very indicative of an opiate overdose. Then look at their lips. When you're overdosed on an opiate, you're not getting enough oxygen. This leads to grayish or bluish skin tone. In darker skinned people, sometimes you'll see that first in the nail beds, but you can also see it in the lips. It's a very gray or blue tone to it. And then third, look toward the lungs. Because your breathing is slowed when you overdose on an opiate substance, the breathing looks very slow, very shallow. Sometimes you can see a very faint rise of the chest. Sometimes it's very difficult to see. Placing a hand on the chest can allow you potentially to feel if there's a rise there or not. If you've recognized the signs and symptoms of an opiate overdose, be prepared to respond. The steps you should take are first and foremost to activate EMS, call 911, and have them en route to further assist you. Second, prepare the naloxone and administer it to the person experiencing the overdose. You will know you're having a response if they begin to breathe on their own, they become alert, and they become responsive and are able to talk to you. Third, once you've had the response and they're breathing, alert, able to talk to you, place them into the recovery position, which means roll them onto their side so they can continue to breathe safely. Fourth, stay with them. Continue to monitor them. Be there when EMS arrives so that you can explain what has happened. Being able to recognize the signs and symptoms of an opiate overdose, as well as being prepared to respond appropriately and quickly, can make a tremendous difference for the person that you're assisting.